Hello, my name is Larissa Mims, and I am your Club Pilates Corporate Master Trainer here to talk to you this month about Pilates after a mastectomy. So, no matter what the reason was for you getting a mastectomy, these are some guidelines to help not only keep you safe, but to help you try to get back to normal and to what regular feels like for your body. So there's a few guidelines. So you want to make sure to start in smaller ranges of motion and then progress from there. You want to focus on stability versus mobility first. So it's not about getting back to where you were before the surgery, but meeting yourself where you are now and then progressing from there. Do not work through pain. So remember, there's a difference between pain and discomfort, and then start with little to no resistance. So a lot of these exercises, really all of them, you can do without any equipment or springs or weights at all. So scapula isolations, your scapula are your shoulder blades that sit right at the back of your rib cage. So imagine these are your scapula, and protraction and retraction are really what is going to benefit someone who has had the surgery done. So protraction brings the shoulders forward in space. Retraction squeezes them back together in space. So as you can see, this could be really helpful for someone that has had surgery in this area here that would need to strengthen and stretch to try to get back to some form of their regular capacity. I like to do them sitting. You can also do them on your back. You can do them on your side. You can do them with weights, however you want, but that protraction and retraction of the scapula really do help. Then we have just regular arm circles. They can be done seated or supine. Supine just means on your back. Just circling the arms all the way around. Circling the arms helps to stretch out that tissue and those muscles and that fascia that are tight from surgery to help get back that range of motion that I'm sure you would be looking for. Arms and straps. So let's say you have a reformer at home or you're back in the studio and you're working out. Specifically, the lower and lifting of the arms, the T-press of the arms opening and closing, and then that internal and external rotation of your shoulder joint. Those are all motions that are going to get those muscles back in line and doing what they're supposed to do. And then of course we have planks. So I would start them standing just at a wall, hands on the wall, finding a nice strong neutral spine. You could also do that protraction and retraction that we talked about in the beginning as well, and then progress down to lower levels as needed. Having a mastectomy is not an end-all be-all. I have plenty of members in our studios that have gone through this process, and while the recovery time is a little slower, they do feel like they get back to their normal range of motion if they do these exercises and work within the guidelines. I hope that this was helpful, and thank you. Have a great day.